Well, the mission of the DPT program is to really reflect the charism of the university, but to do so in a clinical sense, so that when they're treating patients, when they're providing care in that clinical environment, they're doing so as servant leaders. They're caring for people in the way that really reflects the mission of this university.
Walsh University's DPT program is very different from many other DPT programs across the country. I think we really focus on our students, and they are our priority.
We have a very high faculty to student ratio. The class sizes are small. You're going to get a lot of attention. You're going to have the opportunity to publish and really dig deep into research, and you're going to have clinical experiences that are really focused on what you want to do as a potential physical therapist. Our curriculum is a little different in the way that it's set up versus other schools. We always try to make sure that the students have received their formal didactic education prior to going out on clinical experiences, so that those clinical experiences have the greatest value as possible, so that they're treating patients that they know how to treat. They've had that education before, and we feel that's a major strength of our curriculum.
We have engaged them in research. We have engaged them in service learning opportunities. We pull patients in and give them so much exposure early on before they even go out to the clinics, and then they're so successful in the clinics.
I would summarize my time within Walsh's physical therapy program as well-rounded because they take a variety of approaches to make sure that we're learning all the best techniques, information, research to prepare ourselves as future physical therapists.
Walsh has prepared me immensely for the workforce. I mean, I can tell that they're preparing me for the clinical rotations by the feedback that I get from my CIs and from the people that I'm working with.
Our service learning is that we actually do community-based clinics here. We've had those ongoing, and we do those all semester, starting their first semester. They also do that their entire first year. They get involved in a Parkinson's clinic on their second year, and they do a little bit with more of the neurological rehabilitation. And then their third year, they actually are in charge of developing a community clinic for a service population or an underserved population that they have to service with physical therapy interventions or screening or whatever that the need is.
Your second year, you have 2 8-week rotations. Everyone's is in outpatient orthopedics, which is awesome because they prepare you, you know, your outpatient ortho right up until that clinical rotation. And then we come back to school, we learn neuro, that whole sequence, and then they send you into the clinic.
The Walsh DPT students work with us in terms of treating patients, evaluating treatments, setting up treatment programs, and helping us to enhance our clinical research by bringing their skills to us. I find the Walsh students very dynamic, very eager to learn. They're very well schooled in terms of evidence-based practice.
We feel the fact that our students will graduate with, in most cases, 1, in many cases 2 peer-reviewed publications, that it makes them more marketable. There probably is not a PT program our size in the United States that publishes at our rate.
This is very different than any other university. We are highly published with our students. Last year, I believe we had 10 publications from student-driven research alone. And they're first authors on that, which again, if you ask many other universities, it's always the faculty who have to be first authors. But the students don't engage that way unless they don't take that ownership, unless they really understand the reasons why they're doing it. You put them as first authors, that's their name, and they are very proud of it.
As a faculty, we have focused on active learning, being in a lab, letting students do hands-on, letting them practice things rather than sitting and listening to lectures. Physical therapy is a very active profession anyway, and what we've done is really tried to reflect that within our teaching.
I know the Walsh faculty very well, and they're very well respected. Chad Cook is one of the most well-respected therapists in the nation.
That means a lot because you're learning from, you know, some of the top physical therapists or top credentialed instructors that you can have access to. It's a very nice environment to have a faculty that care that much.
Our graduates are very marketable. Over and over again, the human resource person continues to say, I was very, very impressed. This person is so marketable, right? So many different areas that they could go in, and whether that's a recruiter or whether it's somebody from a facility looking to hire our students, they are very impressed.
The Walsh students are recognized in our area as having excellent skills. Their program is well respected and well known, and they're very desirable to hire as employees.
Our students are humble. They are willing to do anything in any setting, and they care about the profession, whether that's in a women's health setting, or sports, or orthopedics, or working with geriatric clients. They're going to know how to do that. They're going to be competent and comfortable in those areas. And they're the type of physical therapist that you would want your mom treated by. They're the type of humble, sophisticated caregiver that every caregiver should be.